Here is your connective tissue microscope slide review for the first quarterly. Most importantly, again, I would encourage you to visit Moodle and to look at the posted images that you and your peers posted. Again, this is what you will see on the quarterly. For connective tissue, this is the first generic one we talked about. Under the category of connective tissue proper loose, this is areolar connective tissue. Pretty indicative. All slides should look similar to what you see here in this picture. You see a lot of space or matrix because, again, this is loose connective tissue. The fibers are not tightly wound. You'll see scattered fibers of different types and potentially colors and thicknesses, and you'll see some fibroblast nuclei scattered around. This is located underneath the epithelia, widely distributed throughout the body, and it wraps and cushions organs, kind of a generic. This is adipose tissue. Do not confuse this with simple squamous tissue. In adipose tissue, you only see one nucleus per cell, whereas in simple squamous, each cell is a thin sliver with its own nuclei surrounding a large lumen. Adipose is found under the skin in the hypodermis, and it stores fat, which you use for energy or fuel. The third kind of loose connective tissue proper, with, again, plentiful matrix, is reticular tissue. This view is zoomed in a bit more than usually we see under our microscopes. Sometimes, occasionally, this tissue is mistaken for blood because of the plentiful cells, but as soon as you see any of these reticular fibers, again, they're not always this thick, but even these thin ones here, that's not blood. The dense connective tissues, having the fibers parallel and on top of each other, thus the name dense. Dense regular tissue found in ligaments and tendons, and we also mentioned in the periosteum. Provides strength and support. Again, you're looking for parallel fibers, you're looking for flattened nuclei here. This is found in the dermis, principally. And here we mentioned how wavy and kind of unkempt the fibers look. The nuclei are more scattered around. They're not in these relatively neat rows as you find in dense regular. You have three types of cartilage. Hyaline is one of them. The matrix here is glassy and smooth, and most of our slides even smoother than appears here. This is elastic cartilage. You are looking for, as in hyaline cartilage, lacuna and chondrocytes in those lacuna. In elastic cartilage, often you find the lacuna paired. It should not look as glassy and smooth as hyaline cartilage. You should see some dark elastic fibers in your view. This is found in the ear. Fibrocartilage is potentially tricky. It does not always look like this picture does. Sometimes it gets confused with dense irregular or even dense regular. The lacuna, you should see lacuna and chondrocytes. They're not as obvious. The fibers should look wavy, but not as wavy as in irregular, yet not as neat as in dense regular. So fibrocartilage is a little bit tricky. This is found in the knee and in between the vertebra. And bone is fairly obvious. Again, some of the markers you have, your central canal, your lacuna osteocytes not visible, and your matrix or lamella, which we talked about. Again, these lamella are in rings around that central canal. Again, you won't be zoomed in this much on our microscope images. Again, the plentiful pink cells are red blood cells. Anything purpley is a white blood cell, and there's several kinds of white blood cells. All right, good luck.